Hi, this is Dr. Michael Chen. I am a clinical professor at Case Western in the Family Medicine Department, and I work as an outpatient family doctor. The topic I've been asked to talk about today is a brief overview of pain management in the clinical setting, which is something that all doctors will have to deal with at some point or other. The first things that you want to consider in terms of treating pain are the over-the-counter medications. And so those pretty much fall into categories of Tylenol, which in the medical field we call APAP for some reason. I'm not really sure why, acetaminophen, and NSAIDs. And they're both good for different things. Tylenol is a good general pain reliever. It can be used safely in most people. The things to watch out for are potential liver toxicity. So liver tox. The maximum dose recommended daily is 3 grams. You could probably safely handle up to 4 grams, but because of some issues recently, they've tried to lower it somewhat. Tylenol is gentle, it doesn't affect your stomach, and it's actually fairly effective at high enough doses. And so what we typically recommend is 2 extra strength Tylenol every 8 hours or so, and that's usually good for mild to moderate pain. NSAIDs are anti-inflammatories, and they are very commonly used over the counter. There are things like naproxen, which is Aleve, ibuprofen, which is Advil. I guess these are two major ones. Now, a lot of people think about NSAIDs as good medications, which they are, but they have significant side effects that you should be aware of. A lot of times we don't think about them when we're writing for them or talking about them. So the big things you can have with NSAIDs are GI bleeds. You can have increased risk for heart attacks and strokes. You can have increased risk of kidney failure. And you also have an increase in your blood pressure, typically, all of which can cause significant morbidity. So they're definitely medicines to be handled with care. I like naproxen because it is the least dangerous to your heart, but it is a little bit more likely to cause GI issues. So oftentimes if I'm writing for naproxen chronically, then I'm combining some kind of stomach medication to protect people's stomachs. We generally want to try to avoid them if possible in elderly patients. There's other kinds of anti-inflammatories besides naproxen and ibuprofen. You probably won't really need them too much, but just to know, according to studies, they're not really any better than these other kind of commonly used ones. So there's meloxicam, there's ketorolac, which oftentimes can be used as an injection. So IM injection. It's called Toradol. And patients seem to like Toradol because they think it's more powerful, but according to studies, it doesn't really work any better. There's also Celebrex, which is a COX-2 inhibitor. Celebrex. And this also works nicely, but according to studies, doesn't necessarily work any better. And it's expensive, so I don't really use it a ton, but when it's generic, I probably will use it more. After NSAIDs, there's the partial, I guess the weaker opioid medicines. The first one is Tylenol 3, so that's Tylenol with codeine. We call it T3s. It's Tylenol with codeine. Oftentimes people can have some nausea with codeine, so you want to be careful with it. I, to be honest, don't really use this a whole ton. There's also Tramadol, which is a partial mu agonist. And this one is kind of nice because it doesn't have Tylenol in it. No Tylenol. And it also has some positive serotonergic properties, which can be helpful if there's if there's some kinds of anxiety or depression in a patient. The bad part of it, though, is if you combine Tramadol with other kinds of serotonergic medications, like most kind of antidepressants, like Zoloft or Celexa or any kind of SSRIs, then you can cause serotonin syndrome, which can be very dangerous. So just some signs of serotonin syndrome. You can have increased pulse, increased temperature, muscle kind of rigidity, very increased blood pressure. It can actually be very dangerous. So you just want to be careful if you're using tramadol and mixing it with other kinds of serotonergic medications.